Well, welcome everybody. I'm Dr. Gonzalez, and on the screen I have Dr. Carolina Maldonado. She is a PhD in human anatomy, and she's currently doing her MD degree at the University of Puerto Rico. And it's very exciting. So please, everybody, welcome Carolina. And don't forget, real quickly, to subscribe, like, and share this video for more. All right, and so whenever you're ready, Caro, we are going to be discussing how we use human cadavers to teach anatomy. And I think this is a very interesting topic. I'm excited for it.
Well, hi, Mari. Thank you for the invitation. I'm very excited to be here with you today.
Yeah, me too. I'm excited you're here.
You can see my presentation, right?
Yes, I can see it.
Yes, great. Okay, well, today I'm going to give a short talk that I have titled Cadaver Laboratories to Learn Human Anatomy. And this will be mostly based on my personal experience while doing a PhD in human anatomy. So today, within the topics that we will be discussing, I will talk about the importance and the impact of learning from human cadavers, also about the ethical practices that we should keep in mind when doing so. And then I'll try to give you an understanding about how do human cadavers become available for these purposes and who can be a donor for this. And lastly, I'll talk about how does a lab actually look like in medicine school or in a graduate school like ours, or like our experience was. And lastly, I didn't put it there, but I'm also gonna end my talk today giving you some tips, like I know Maddie likes to do also.
Awesome.
So to let you know, the target audience for my talk today, so I hope to be talking today to high school students and also to college undergraduate students that have an interest in pursuing a graduate level education, either be a master's degree or a PhD in human anatomy, but also students that are interested in doing medicine school or dental school or even physical therapy. In our school, I know that physical therapy students do have human cadaver experience, and I know they mostly focus on limbs and whatever is most relevant to them. But yeah, just to have an idea of who is exposed to this kind of experiences when they go to graduate school. So I want to start by, why do we use human cadavers? Many people could make us a question and say like, well, haven't we advanced so much in technology? Don't we have like so many apps where we can see the human body, and maybe that can be better for us.
Or the anatomash table.
Right? Yeah. Like I know you've shown some images, and it's amazing how many things you can learn from that. Yeah. And it gives you a representation of the human body, a very detailed representation of the human body. It's very powerful. But there's also many benefits from using human cadavers to learn human anatomy. And one of the most important benefits is the emotional experience that we have during our dissections. And it has been documented, and many people have spoken about this, that throughout the learning experience, when you are able to have that emotional experience, because it's intense, sometimes it might be scary, sometimes it might be very impressive to you, and you might even get a little dizzy at the beginning, you might feel a little bit nauseous. You know, it's a complete experience that also includes a very strong emotional experience. And that influences your learning capacity very much. I always think that the female cadaver that I had the great honor of dissecting in my human Anatomy Laboratory, I think that I will never forget those images in my head. Like whenever you talk to me about any specific part of the body, I might not remember 100% of it, but a lot of it, I just come back to that same body. I come back to those images that I'm able to remember from her because it's very powerful, the experience.
Yeah, I can relate to that. Did you had a chance to name the cadaver that you were using?
I did not. I never
Okay.
did that, but I know many people do.
Yes.
Some people like find a name. So most of the time we don't know anything about this person. It's like completely anonymous. So you don't know even their age or their name or anything. But I know some students go ahead and name their cadaver.
I did name
Um,
mine. Mine was called Joe.
Joe, that's nice. You're able to have that connection with your cadaver, right?
Right. Right.
So we'll talk later on about the ethical practices in these laboratories. And if you guys are exposed to this kind of experience and you go ahead and name your cadaver, I would like to ask that you do so in a respectful manner and that you find uh, it's okay to find a name and to name them, and have something to be able to refer to them, but always do that in a very empathic way, or always considering this is a person that is somebody's family member, and just as you would to any person that you know. So other of the benefits that we have when using human cadavers is that, well, of course, it allows us to identify the specific location and the position of the structures. And that's very important because even though we are able to do that also with the digital platforms that we may have to study human anatomy, the the task that you go through in, for example, let's say you're working with the stomach. So you're dissecting the stomach and you remember that you first had to dissect something and move it this way, and then you were able to access the other thing. So it gives you a very strong perspective of where specifically are those organs or structures located. And of course, this allows us to identify the texture and the strength of different types of tissues. But we should have in mind that these cadavers that we use, they are always fixated or fixed using different kinds of chemicals. I know some laboratories, I didn't know this, but preparing for this talk, I learned a lot of things, a lot of new things. But one of them was that some human anatomy cadavers use frozen cadavers. I never knew that before. Have you ever had that experience, Maddie?
No, not
No.
really. So I'm also
So,
learning. I'm also learning with you as we go through.
so the ones that I've had the experience to work with have always been fixed with some types of formaldehyde, right?
Formaldehyde. Yes.
So yeah, the use of human cadavers for the purpose of education, it's believed to be more efficient than the use of simulated human body with modern technology. So now coming into the ethical practices that we should always keep in mind when having this amazing opportunity to learn from human cadavers. One of the very nice things that I read while preparing for this talk was a website which I included on my references at the end, where they talk about the idea that this is your first patient. And I found that to be very, very cute and very real because as medical students, for example, I had this experience while being both a medical student and a graduate student in human anatomy. This is very true because when you go into med school, you go through all of these basic science classes like biochemistry, embryology, physiology, histology, and then you go into anatomy, and you have the opportunity to to interact with this human cadaver. and you're very excited about the possibility to learn later on, have interactions with your patients, and be able to to interview them and help diagnosing them and help treat them. But so at the first year, mostly you might feel like, oh my God, when am I gonna get to have that experience with actual patients? I'm stuck here just learning all this science. I want to learn medicine. Well, it's important to first go through this experience, and I encourage you all to see your cadaver and to connect with your cadaver as if it's your first patient. And you should treat your cadaver as if it's one more patient that you're going to have the honor of interacting with in your life. And, it's a good opportunity to put into practice all those ethical principles that you already know and that you will be taught throughout your experience in medical school. So it's important to have an ethical behavior in every stage of the process. So that includes before coming into the cadaver lab, while you are in the cadaver lab, and after. So many of these laboratories have what we call a locker room. So it's like a first little room that you come into, and you might be asked to leave your books there and your backpacks and everything that you bring with you, and just come into the laboratory with your white coat and some gloves. Now you might need to wear your mask. I know some people use like little Vicks, or they put a little something in their nose to kind of help with the smell and kind of keep them, feeling okay. They might get a little bit nauseous, mostly at the beginning. So it's important that, for example, you're coming into the locker room, so you're not even in the laboratory, but even there, it's important to behave in an ethical way, to never speak about the cadavers or the bodies like, in a disrespectful manner. Always think that they are humans. They deserve all your respect, and they have been so amazing in having given you the opportunity to learn from them after their death. So you should always keep that in mind. And also, well, of course, during and after. So we're going to get into those ethical practices during the laboratory, but then I would just like to comment on the after. Well, after you're gone, always keep in mind also that these people deserve your respect, and for like confidentiality, like you don't necessarily need to be speaking openly to everybody about things that you might have found in your cadaver. Try to keep that in mind and be respectful in that way.
Right, because this was a person.
Exactly. So coming into the ethical practices during the laboratory, I was doing, my search for the talk, and I found this great paper about from 2020. It's titled "The Practice of Ethics in the Context of Human Dissection: Setting Standards for Future Physicians." And they provide a really nice table that I have included here completely. So, for example, where we are always advised to never eat food around or drink, even mostly also because it might be harmful for you, given that there are chemicals in there, and you shouldn't be doing that. But also out of respect and out of the idea that this is a place where very important tasks are being performed, so you should always keep that in mind. One of the most important, I think, is number 3, where they talk about photography of any kind or video recording should be prohibited in the dissection room. So no selfish, no taking pictures of any structure that you're seeing, not even for yourself. You might think like, well, I'm not
on social media.
Even worse, right? But even if you think like, I'm going to take a picture just for myself, just for me to remember, well, that's not appropriate. It's never appropriate. You should always keep your dissecting manual with you if you want to remember a structure, find it in your dissection manual. Look it up in other books, but you should never be taking pictures or recording in the area where you have the cadaver. If you might want to do so, for example, in the locker room, to be able to gather around with your peers or with your white coat and, kind of remember the experience. You might be able to do so if your university allows you to, but never that a cadaver is exposed, and you might be able to see it even in a little corner of the picture. Here, number 8, maintaining anonymity of the donor should be the priority. I think I kind of touched into that one. And then we were talking about the names, right? So number 9 says respectful reference to the donor is mandatory for students while communicating among themselves and with the staff, okay? So always be sure to behave in a professional way. And then lastly, I found it very interesting that they mentioned on number 10 that students should be encouraged to express their emotions related to the experience of confronting dead remains of the donor. So you might want to gather around with your peers and talk about how you're feeling about the experience, how it has impacted you. I remember in my class, we were asked to write kind of like a journal, kind of like a diary of how we were feeling, what structures we had learned that day, or how it made us feel. And I think that's a very healthy way to go through the experience. I wanted to say, for example, I've always been very interested in forensic pathology. So I've always been very interested in post-mortem bodies. And when I went into the human anatomy class, I was like, this is gonna be the best. This is like my time, like this is what I'm meant for. And actually, well, that was mostly true, but actually I had a very strong emotional feelings,
Reaction.
Reaction, yeah. I remember even having nightmares. Like I couldn't remember, like it was like not clear images, but like there were like very dark things, and I was like, what's going on? And I think it was all part of the process, And so
it takes a moment to
right?
reality. It takes a moment to assimilate the situation. It's true.
So I think it's very helpful if you talk to your peers and you, maybe not everybody, but you might find 1 or 2 students in your class that you might relate with and you feel comfortable being vulnerable with. So I definitely encourage that for you. It might help you go through the experience in a healthy way. So moving on to how do cadavers become available for the purpose of education. So for example, I am from Puerto Rico, and I know this might be slightly different in other states of the United States and different parts of the world. But for example, in my university, this is arranged by a specific program that is called the Body Donor Program. And they are the ones that arrange all of the donations, and they allocate the bodies to wherever that needs to go. I know there are certain universities that do that on their own. So there might be certain universities in the States that have their specific donor program where you might be able to arrange donations with them, and you know that it's going to go specifically to that university. At least, and they might have their own regulations, but at least for you to have an idea, here in Puerto Rico, every adult over the age of 18 can register to become a body donor, or even if you did not register in life, after death, your family members can arrange to donate your body if they understand that that is something that you would have liked, and they are okay with that. However, there are some exceptions to accepting some donor bodies, and these are mostly due to the protection of the people that will be conducting the dissections. And those exceptions, for example, might be bodies that test positive for HIV, hepatitis viruses, tuberculosis, or for example, prion disease like
Creutzfeldt Jacob.
There you go.
Prion disease.
That prion disease. There are several, but that one. So those bodies that might test positive for some of these diseases might be rejected, but mostly for the protection of the people that will be conducting the dissection. So how many people typically signed up to donate their bodies? I understand not everyone might want to donate their body for that purpose. Well, to give you just an idea, I have included here the estimated population of Puerto Rico, so you can kind of have an idea of how that might be in your state. And taking into consideration that population, well, in the past 5 years, you can see that there might be around 100 patients, 100 people that sign up to donate their bodies. I know here in 2018, it's way lower, but I just want to give the heads up that in 2017, at the end of 2017 in September, we had a really strong hurricane in Puerto Rico, Hurricane Maria, and it pretty much devastated our country. So in 2018, nothing was like it normally is. So I think that might be the reason why we have so little amount of patients signing up for donation of their body. So, but I think in all fairness, we can say that around 100 people donate their bodies per year for the purpose of education. So that's people signing up for donation. But how many cadavers do we actually use for the purpose of education per year? So these are the numbers for 4 different years that I found. And we have 58, 54, 84, 88 cadavers in those years. So we can say maybe an average between 60 and 70 cadavers are being used every year for the purpose of education. It is estimated that out of these cadavers, 420 students benefit in their educational process, and this it's not limited to medical students and the ones that I mentioned at the beginning, but this might also include research opportunities in post-mortem bodies, and also advanced training for different medical specialties or subspecialties, like for example, surgery. In my university, they have it's a cadaver lab, but it's mostly based on heads, and it's for neurosurgery training. And they're able to explore different alternatives of accessing different types of structures in the brain for their surgeries. And you can imagine how powerful that can be for some people that have tumors that might have been cataloged as being inoperable because you cannot access them without doing a lot of damage to the human brain. But using human cadaver heads, they're able to practice, and they're able to make it, in a way that they can then translate into real life patients that can benefit from that. And also in our university, I've even had the experience of helping out ophthalmology residents. They go in and they kind of review the eye anatomy and the visual system anatomy, and they're able to go back and look at the eye, the extraocular muscles, the innervation, the blood supply, so they can have a refresh of their human anatomy that they took when they were first year medical students, Okay, so coming into how does it actually look like being in a human anatomy cadaver lab? So here we don't only use cadaver, but we also use osteological replical models. So these are like plastic models, or I don't know which material they're made from, but they just look, you know, when you get the skeleton and it has like all the parts, the head, the sternum, all the ribs, the arms, and you're able to look at specific bones in a very detailed way. You're able to see the grooves and the different parts. So we also use those in our training. And we also use imaging materials, like, for example, MRIs or CT scans or X-rays. And even in the exams, we are asked from those, or even we have a really funny name for those, but we also use like, but those
cuts.
are images.
Yeah.
And then
cuts.
Exactly. So we even use those. I think those are made from just those are digital, right? Like models.
Yeah, and we got the transverse section, the sagittal section, yeah, the coronal section.
But those are not like real pictures of anything, right? Those are like made digitally.
For what I remember, I think they were both. We got the imaging, and we also got the actual cut of the cadavers on the different
specific people
picture of the actual cadaver.
Dissected real cadavers, and then
just like in those bodies exhibition and the I forgot the other one. Yeah, like bodies exhibition.
Cool. My experience, and I know Mari's experience also, was studying the body by parts. So, for example, we say we're going to study the arm today, or in this block. And in the arm, you study everything from the outside anatomy to the blood supply, the innervation, the muscles, everything that is in that part.
Yeah, this is called regional rather than systems. Yeah.
Systems. So there's a different type of approach that is going by systems. So, for example, you might focus on the cardiovascular system, and then you study the blood supply of everything in the body, from the head to the toes, and you learn all of the bifurcations of all of the arteries, and you know, not by the specific part of the body where they are at. But our experience was studying it by parts, the regional approach. So what that means is that we have different blocks. I kind of remember 4 main blocks, and in those, it was mixed, something like what I'm showing you here. So, for example, we studied the upper limb and the back, including the muscles, the spine, the spinal cord, everything in the back together. And then we had like several weeks of dissection, and then you have the exam, and then you move on to a different block where it might include, for example, the lower limb, and then the area of the mediastinum. And then you study the heart, the lungs, the aorta, and everything related to that. And then on a different block, you go into the abdomen or the peritoneum, and also to the pelvis and all those organs located at the pelvis. For example, in females, the uterus, the ovaries, and in males, well, the prostate and And lastly, our last block was what we call head and neck. So here is included everything from the outside to the inside. So we go through the face, the facial muscles, the eye, and you get to do the dissection of the calvarium. You get to see the brain, the different parts of the brain, and that's the last one that we had. And here is actually when you get to see the face of your cadaver, because prior to this experience, while you were doing all of the other dissections, we typically have like a cloth covering the face of this cadaver. So that kind of helps with you getting used to the exposure of this type of scenario. Sometimes it might be hard to see the face of a cadaver just there. Uh, so that it kind of helps that you've been doing this maybe for several weeks, maybe a month, maybe 2 months, and then you go into having the experience of actually looking the face and dissecting the face. Do you remember that part, Maddie?
I do. And for me, it was an exciting moment because I felt like I was getting to know the person that I like, putting the face to the person that I've been working with, the entire semester. And it gave me like a respect or another perspective for life. So
Yeah.
I was very excited and humbled at the same time.
I have this, when I get really nervous, I laugh a lot. And that happened to me when the face of my cadaver was exposed. I had like this nervous reaction. I started kind of laughing, but then I started feeling really weird. And I realized that, whoa, this is feeling intense for me. So prepare yourself and know that if you feel weird, if you feel kind of a little bit bad, a little bit whatever, or maybe you don't feel anything too intense, well, that's good also. That's okay, but whatever you feel is okay. And it's part of the process, and you'll get used to that if you want to do this in the future, or if it's only your only experience. Be okay with feeling however you feel, and just focus on learning and focus on doing what you are there to do.
Yeah, just take a minute for yourself.
Exactly. The learning process and like the way you kind of assess if you have been learning in the process. For us,
the assessments.
The assessments. For us, it was a mixture of theoretical exams, so multiple choice exam questions. Some of them might have a relationship to clinical aspects. So, for example, if you are talking about the nervous system of the upper arm, you might be asked about a specific posture that the hand is placed. And by knowing that the hand is extended or flexed or in a specific way, you might know which nerves are affected, or also with the lower limbs, Or some questions might not necessarily have a clinical relationship to them, and might be just focused on specific structures and the relationship of the structures with themselves, like what is anterior to what structure. Or a really notorious question for us was like, if I insert a probe from the skin to the abdomen or into the peritoneum, how many layers or which layers have I crossed through, or what's the third layer that you go through? And you kind of need to know all of those things. And also we have practical exams. And practical exams are basically using the same cadavers that you've been using for your dissections during the block. And they typically use all of the cadavers that the students have been using. And the faculty comes in very early before the exam, identifies different types of structures in these bodies. They might use like index cards or any way to be able to let you know what the question is. And you might find structures that are pinned with like a little metal pin.
T-pin, it's called a T-pin.
T-pin.
Yeah, like the letter T.
Yeah, and they also used to use ones that have like a little plastic colored ball in the top, like a little red ball in the top or something. Yeah. That would be like easier for you to spot. And they just say like, what is this structure, or what is the name of this nerve, or what is the name of this muscle. So the worst are the ones where they say name this structure, and you might not even know if it's an artery or a nerve or a tendon. You're like, What?
And do you remember those with the magnifying glass on a
Yeah,
specific area? I remember that on the on the ear for the
the inner
ossicles,
ear. Yeah.
and or the I think it was the internal carotid or something like that. I can't remember very well, but yeah,
Yeah, I remember that for the inner ear, you do a dissection through the through the
the skull.
brain
Yeah.
to the skull, and they would put like they would set it up really nicely to put like a magnifying glass there, and something was pointing at something, and you had to like pay close attention, but be careful to not touch anything or move anything around. That was very cool. So related to the practical exams, I noticed that Maddie actually has two really cool videos on her YouTube already, where you are going to be able to have an idea of how these practical exams actually take place. And she explains like you will be asked to move table to table, and you will have 2 minutes typically for every question or every two questions. And so I encourage you all to go and look at them. I put the names here of those two videos, and she also uses like really cool apps to show you like how the cadaver, for example, look at the dissection table. So I found those really, really nice. So you should check them out.
Oh, thank you.
Yeah, sure. Moving on to what resources we use or I maybe recommend for you. Talking about free access websites, definitely I encourage you to use, for example, the University of Michigan Medical School website, where they have like practical exams, and they are very cool. I just put like three small screenshots here. For example, within all the subjects that they cover, I think they cover the complete cadaver. I showed like the cranial cavity and brain. And for example, you just come into a little practice test. And for example, here you see the skull from the inside, and they're pointing at a specific nerve, and they say, identify this nerve. And then you think about what the answer should be, and then you click again, and the answer pops up. So you're able to review those concepts really nicely. And then one app that I use very much, but I don't know if other people use it. I don't know how common it is. I don't even remember how I got to it, but I think it was very useful for me. Was an app called Cycle Body, and you're able to remove things and add things based on the system that you want to be showing, or you can have the complete body and kind of be like peeling from the outside to the inside. And it's very nice when you have like a specific question, not to learn like everything, but if you have like a specific question about where something is and relationship to the rest, you can go in and identify the structure and then put like extra layers on top, remove them back again, and you're able to understand. And of course, you can move it in a three-dimensional way. So you can look at it from the back, from the side, from the other side. It's very nice. And there are also other websites that are very, very, very helpful, but you need institutional subscriptions for them. And these are Net Anatomy and Aklan Anatomy. So I don't know if you could pay them on your own, but I don't necessarily encourage you to be spending the little money that you may have on these types of things, because there are many resources, and I don't think you should be spending a lot of money on these types of things. But watch out if your institution actually offers them. If they do, use them, because they are very, very, very good. In terms of books, the Nether Atlas of Human Anatomy is like the top book that everybody should have. I do encourage you to get this book physically, like have it with you, not only digitally. If you love the digital world, if you have like an iPad where you can access very, very easily, well, maybe that works for you. I'm a little bit more old school. I really like the paper one. However, in the Cadaver Lab, it might be slightly tricky to have it with you and not get it very dirty because you sticky, right? You might want to like flip pages, but you have your gloves on and they're all full of things you don't want to get in your book. So I do know people that used to have their iPads put into Ziplocs. They would close the Ziploc very nicely, and then they would be able to touch it, and the iPad would respond. So that might be a good idea for you, but definitely try to learn from that book because it's very good. For us, we typically use the grand dissector to go through our dissections. It's very well explained. It takes you step by step, and it shows you where you should be doing your cuts specifically and what you should be able to find. Sometimes it advises you that here you would not want to cut too deeply because what you're looking for is very superficial. So you're going to be able to move along in your dissections really nicely if you have your book and if you have read through it. It's not only to have it, you need to read it. And I encourage you to read it before coming into the lab, because if you go into the lab and you have no idea what you're going to be doing that day, that might be a little bit hard for you to take advantage of the experience and actually learn all of the things that you could be learning if you had come prepared.
And the professors, typically, they don't explain it in the lab. You just have to read it and know. And if you have questions, then you will ask your professors or your TAs. But usually, like from our experience, I know that we have to be ready.
I remember I once asked a question and I was answered with, "You should look for that in your book." I was like, "Oops." And they were right. Like I was not prepared, and now after you move from that experience and you become a TA, you realize that the type of questions that they're asking comes from not even having a clue of what they're supposed to be doing, and that is not what it's not the best way for you to take advantage of the experience. So do it for yourself, do it because it's a great opportunity to learn really good human anatomy, and you will need this for the future. I was telling Maddie that now that I've come into third year of medical school, I had the opportunity to go into the OR, to the operating room with the team of gynecology, and they were doing, it was called a colposacropexy. It's like attaching the top of the cervical canal to the anterosacral ligament to avoid prolapse of the vaginal canal. And as they were opening the abdomen, I was like, what's that? Like, it was hard for me to identify structures. And I was like, I have a PhD in anatomy. I should know this. But,
it's just, it looks very different. And in a person that still has blood, everything looks red. It's totally different from a cadaver that has been, all that blood has been taken out, and all they have is the formaldehyde. So everything is more of a grayish, or I don't know. It doesn't look like an actual living person.
Yeah, trust me, you're gonna want to have a good foundation of human anatomy as you move along in medical school for many different clinical rotations or clerkships. Even if you might think, well, I don't want to be a surgeon, I don't care. But yeah, you do, because it's important for you to know the basics in order for you to provide good care for your patients later on. Even if you want to be whatever you choose to be, family medicine, pediatrics, anything, you want to have a good baseline knowledge on human anatomy. It's important. Well, I also want to mention the Yokoshi. I'm sorry if I'm pronouncing that wrong, but this book is amazing. It's top. This book, so the matter, those are drawings. They're very good, but they are drawings. This book are actual pictures of dissected human cadavers that have been dissected by professionals. You know, there is like no way that as a student you are gonna be, well, maybe some of you can, I don't know. But me, there was no way that I would have been able to dissect and see structures as they are presented in this book. So it's a really good one. I know like acquiring some of these books might get a little pricey. I remember this one, I actually asked one of my professors if she had a few different copies that she could lend me one. And she was gracious enough to lend me one of her copies. I don't know if she had multiple, if she just had one, but she trusted me with her copy. And it was a great advantage for me to be able to have access to this book. Maybe you can team with a few of your peers and get one for a few of you guys and split the money. I don't know. And now I would just like to finish with some tips, specifically for the anatomy class, but I think they are use them for it. So the first one is to repeat to yourself the structures all of the structures that just come to your mind. Like I remember I used to do this while I was taking a bath, for example. And like it's time that you're not necessarily doing much with your brain. You know, maybe if you're cooking alone, like you don't have anybody around, because if you have some people around, you might want to talk and have a good time and just relax. But if you're alone and you're not doing much with your brain, you might want to do something like this. And I remember I would just like try to go through the structures that I had seen that day and try to say the names, like the complete name, just like, yeah, I remember I saw this and this. No, like this is full, this and this and this. This is full, this and this. And try to be specific on your brain, you know, like don't just say like if it has like a name that is composed of 5 different words like the antero, lateral, whatever. So just say it completely, because you might be able to notice that, oh, I do remember it was like the circumventing or I don't know artery, but I can't remember which one specifically. So there you might be able to say, oh, I didn't know that one as well as I thought I did. So those that you identify that you do not know, then you have a great opportunity to just go back to those, you know, and the ones you do know, repeat them to yourself as much as you can so you're able to force that memory. And also something that helped me was just taking a white piece of paper and just writing it all down, like with no specific structure in mind, but just everything that I remember. And as I wrote the name, try to think about the structure, like, okay, yeah, this is here. Oh, wait, I can't remember where exactly this one was. Like, I remember the name, but I couldn't pinpoint it in a body. Okay, let me go back and let me look for it. Maybe I can look for it in the Yoboshi one, that those are real life pictures, you know? So always try to have like that, be questioning yourself in your own mind, you know, like, what do I really know and what is not so clear? Another strategy that is very useful is teaching what you do know to somebody else. And here you might not necessarily know it like 100%, but you could have like some notes with you and you say like, okay, I'm gonna teach it to you. Okay, and then as you're talking, you go like, oh wait, I can't remember this well. Oh yeah, it was this. Okay, so as I was saying, and you go back and, you know, and just like the intention of explaining it to somebody else, you would notice that it helps you a lot to just consolidate that memory and make it your own. I remember in my while I was taking the class, I don't know what, I think so we had very few females, and some of the females that we didn't have an uterus. But because typically most of these cadavers are people that have advanced age, and they might have their uterus removed during life. So I think we had like only 2 uterus in the complete lab, and I had my cadaver was one of those. And I remember people kept coming to my table like, "Oh, can you show us? Can you let us see? And can you explain it to me?" And I remember asking like, "Why are they asking me to explain? Like I know nothing. Like I don't understand anything." And then I started explaining it to people. And then after I was like, I knew it super well, because I had the opportunity to say it over and over and over again and teach it to other people. So it helped me a lot. It was very nice. Another strategy is trying to quiz yourself. So actually look for questions. For example, there are books or different websites that have standardized questions that might be similar to those that you're going to encounter in your exams, and try to answer them and see if your answer is correct. Read through the answers. So, most of these books typically will tell you why it is not A or B and why it is C, and you get to understand better everything that you have learned. And lastly, repeat and repeat it and repeat it and repeat it and repeat it and repeat it. Like if there is one secret, which I don't think there is, but if somebody would ask me, just give me one tip to learn something, it's repetition. Like there's very little things that you will learn like for long-term memory if you just see it once and never see it again. Like maybe if you have like a really strong emotional reaction to it, you might be able to remember it. But this is a lot of material. It is a lot, and you need to repeat it and repeat it and repeat it. So another thing is trying to be present during the learning process. And you might have heard about being mindfulness, It's like trying to stay here in the present moment and not have your brain occupied with other things like what I'm going to do when I get out of here, what I am going to have for lunch. Maybe I can check my phone and see my social media. Maybe let me see if somebody texted me back, and thinking about many other things outside of the lab. Well, try to be mindful during the experience, and that will help you a lot to be able to remember what you should have learned that day. And for that, well, as I mentioned before, I think being mindful also includes, like, for example, preparing for class, like coming into the lab already knowing what you should be doing that day. And that helps you to stay grounded in the moment, to be purposeful, and to know like what you should be able to accomplish in the following 2 or 3 hours of dissection, and actually get the most of the experience. Also, being very vulnerable with yourself and honest. So be able to pinpoint what you do understand and be like, yeah, I know, I get it, it makes sense for me. I get it. I understand it. I know this already. But also at the same time, be like, this, I have no idea. Like, I don't know what I'm doing. I don't understand anything. It all looks like a mess to me. Like, I have no clue of nothing that is happening. Well, that's also important because then you will have the opportunity to just focus on that, or finding a peer that is actually somewhat very good in that specific area. And you can be like, hey, can you give me like a little teaching moment, And they might be able to explain it to you in a way that you haven't seen it before, and maybe it can stay with you. And so try to schedule study time. So say like, okay, maybe today I have class from this time to this time. I get out at 4, then I am going to eat something, take a bath, and then at 6, I'm going to sit down and I'm going to study from 6 to 8, to 8:30 to 9. And that's going to be my study time. And when 6 arrives, you are sitting down, you're studying. If people are calling you, I'm sorry, I'm not answering because I'm studying. I can call back at 8:30 when I said I was going to be done, because just waiting for a perfect moment to arrive where everything feels peaceful and you feel like, just to sit down and study, that will never happen. Believe me, you will always find something more interesting, everything. Like, we live in a world that's full of distractions. So you need to set apart the time and allow yourself that time to focus on what you should know and study and prepare for your exams and for you to grasp all the knowledge that you should be getting from this course. Also, I know that Maddie has really good tips for studying. So I saw a video she has that is titled "The Best Way to Study for Anatomy and Physiology: Steps to Succeed." So go and check it out because she has really good tips. And I know she touches on some of these concepts. So with that, I am finished. I included some of my references today. I think here number 4 was the one that talked about the first patients. And that was very interesting to me. So you can go and check them out. And of course, this is my email. If you have any comments, any questions, anything that you would like to talk to me about, feel free to send me an email.
Yeah, Carolina, that was amazing. That was amazing.
Thank you. Let me go ahead and stop sharing.
All right, so thank you for sharing all of that information. I think that it's amazing. And so anybody who wants to contact you just through your email, is there anything else, maybe social media or something you want to share or no?
Yeah, I have Twitter. You can access me through Twitter. I think my handle is Caro Maldonado 1.
Okay, I'll just put it on the description below the video so that everybody can see it. All right. Well, cool. Thank you so much, Carolina. This was amazing. And then I think that's all we have for today. I want to say again, don't forget to subscribe, like, and share. And also comment if you have any questions or suggestions or whatever. Thank you for watching, and I'll see you on the next video. Bye, everybody.
Thank you, Maddie.